We have not yet begun to see the impact that the coronavirus might have on our healthcare systems. But if you or a loved one is on Medicare, we can at least help make sure you're enrolled and know where your resources are if you need help. And that's where the team at Medical Reimbursement and Management Services comes in. Beth Cooper is the MRMS Administrative Assistant, and Tameka Banks is new to the MRMS team as Senior Solutions Advisor. Welcome to you both.
Thank you.
So let's start with just getting enrolled. Beth, I'll start with you. What are some of the pitfalls that people need to watch out for in getting enrolled in Medicare?
Well, they need to make sure that they enroll during the correct enrollment period. Anybody who's already receiving Social Security benefits and approaching 65, they're automatically enrolled in Medicare. They receive their card about 4 months before that, they're enrolled. If they're not receiving Social Security and they're turning 65, they need to start preparing, talking to Social Security or going online to complete the application no earlier than 3 months ahead of time. People who are working, turning 65 but are working, they should contact Social Security and talk about what they need to file for, because if they have employer group health insurance, they may not have to file for Medicare Part B.
Tameka, in your experience, what's it been like for people who are trying to get enrolled in Medicare? What are some of the most common questions they might have?
A lot of people have difficulties signing up, a lot of times just navigating through the computer systems, a lot of paperwork. They start getting a lot of mail that comes through. So ciphering through that, many times there are a lot of the children of the 65 and older are contacting, needing assistance for mom and dad.
Understood. And so what kind of help can you give them when they call you at MRMS? What happens next?
We will set up an appointment and go through whatever paperwork they have, answer any questions that they may have as well.
It's really nice to have somebody by your side because, as you mentioned, it can be really daunting, even if you understand all the lingo, just navigating through some of the government medical websites. So when do we start the process for Part B?
For Part B, if you're turning 65 3 months ahead of time, if you're not receiving Social Security benefits, if you have employer group health insurance, you can refuse Medicare Part B if your employer has more than 20 employees, and you can delay that until you no longer have the coverage with your employer or you retire.
And you guys at MRMS have some regular informational sessions, don't you?
We do. The second Tuesday of every month, we have an educational talk that we give. It's strictly educational, just to educate people about the different types of Medicare enrollments and so on. And all you need to do to attend one of those is just give us a call at 693-1060. Let us know that you are attending and how many will attend, and we can educate you.
Sounds good. Ladies, thank you so much for being with us.
Thank you.